Hello, everybody. Welcome back to the Incubator Podcast. We're live at the CHNC Symposium in Denver, Colorado. And this morning, we are joined by Dr. Whitney Thompson and Dr. Theresa Grover. Guys, welcome back to the show. You've been on the podcast before. Very excited to hear what you have to share with us today. You are both working on, if I'm not mistaken, the Mentorship Award. Is that correct? Can you tell us a little bit about how do we designate the best mentors?
So I can speak just a little bit about the program. So I'm the chair of the research committee for CHNC. And so in 2021, we started this Mentored Fellow Research Award, I think recognizing that we have a unique opportunity here for our trainees to learn how to use large data registries for research. And so set up a mentored program, which is a competitive grant application for them to do a project using the data from CHND, but it's also then mentored not only by local mentors, but also within CHNC, working with the fellows that are chosen for the projects, with the data analysts and our PhD statistician to really learn how to design the study, how to pull data correctly from a large data registry. So Whitney is the fifth out of, now we have 7, I think, Mentored Fellow research awardees since 2021. And
I think what is so cool about the award is it is very comprehensive, right? I think lots of people can either do the mentorship piece or do the financial piece, but why is it important to have this kind of all around focus, statistical support, writing support? Why does that change what a fellow's able to do in the time frame allotted?
Yeah, I think that it's a unique skill set to learn how to use these large data registries. It's very different than doing a clinical research project or even just using your local data for a project. It's really complicated sometimes to just define the cohort of patients and which patients you want to include and who you exclude. That takes a lot of effort to actually just come up with that. And then all the nuances of a large data registry, as far as really understanding the data that you're pulling out and make sure that it's exactly what you think it is, and so that you interpret correctly and you make the right conclusions. And that takes multiple people to understand that, and our data analysts and statisticians know this data registry backwards and forwards and can help us understand that when you pull a specific variable that that it represents what you think it does.
Yeah. Last year we had the opportunity to interview some of the data specialists, data analysts, and we haven't had the time to cover that so far this year. But I think that's what makes pulling from this registry, or what the CHNC does, really valuable. It makes the data, I think, as clean as it can be. And I think that's something, thank you for mentioning that. Whitney, tell us a little bit about your experience with the program.
Yeah, it's been a phenomenal experience. So my project is focused on neonatal onset urea cycle disorders. And so
huge topic.
Yes. And very, rare diagnosis in the NICU. And so getting to learn how to work with a huge data set like this has been, very important for me, not only for this project, but going forward in my career studying rare disease. Given that I'm both a neonatal fellow, but also a genetics fellow, hoping to dedicate my career to studying rare disease. And so getting to understand how to pull from this data set, what the data means, the statistical analysis, it's all been extremely helpful.
And I think it underscores the value, one of the values of having really large data is for really rare disorders to get even enough patients to even talk about the problem.
Exactly.
In your presentation tomorrow morning, neonatal onset urea cycle disorders, an uncommon mimicker of common NICU conditions. So what do we need to know about the urea cycle disorders and how they mimic other pathologies so that we don't miss them in our units?
So I think one of the big takeaways from my project is that these disorders present very non-specifically. They really look like sepsis. And so the whole idea is not to miss it, to have a high index of suspicion, to get a pneumonia if you're worried about sepsis, maybe starting day 2, 3 of life in the NICU and through that first week or 2 in particular, because we saw, a lot of these babies presented between day 3 and 5 most commonly. And again, very non-specific with respiratory failure, hypotension, but nothing really to distinguish from sepsis. And so maintaining that high index of suspicion.
So interesting.
Very interesting. Well, so for people who are interested in applying, becoming a mentored fellow. It looks like the application timeline restarts in February-ish of each year. Tell us a little bit about the process.
Yeah, so we really target first year neonatal perinatal medicine fellows to give us plenty of time to walk through the process and do the mentored piece of this as well, and get the data with plenty of time to actually analyze it and get a publication by the end of fellowship. So we're targeting first year neonatal fellows. And there's an application process. We have a Q&A session at the beginning to answer questions and discuss whether projects are good, projects for this specific award. And then it's an application process that the research committee reviews all of the applications and chooses typically 2 awards each year. So
Super nice.
very exciting.
Thank you both for spending the time and sharing with us these insights, and have a good rest of the conference.
Great.
Thanks so much. Thanks for having us.